Did you know that in 2023, nearly 15% of U.S.-educated first-time test takers failed the NCLEX RN exam? Yes, you heard that right, 15%. That's about 1 in every 7 candidates who sat for the exam that year, not making the cut. A startling figure, isn't it? It certainly gives you pause. Why is this statistic significant, you might ask? Well, the NCLEX RN, or the National Council Licensure Examination for Registered Nurses, is the final hurdle that nursing students must overcome to become fully registered nurses. It's the culmination of years of hard work, study, and dedication. It's the gateway to a rewarding career in nursing, one that allows you to make a real difference in people's lives. But it's also a formidable challenge. And that 15% figure is a stark reminder of this fact. It underscores the reality that despite all the time and effort put into studying, despite all the knowledge and skills acquired over years of education, a significant number of candidates still fall short. It's a sobering thought, especially for those who are about to take the plunge. Why does this happen? There could be a number of reasons. Perhaps some candidates underestimated the difficulty of the exam. Maybe they didn't prepare thoroughly enough, or they didn't use the right study materials. Or it could be that they simply couldn't handle the pressure on the day of the exam. Whatever the reasons may be, the result is the same: failure to pass the NCLEX RN exam. And let's not forget what's at stake here. Failing the NCLEX RN exam can have serious implications. It can delay your entry into the nursing profession, potentially costing you job opportunities and income. It can also be a significant blow to your confidence and morale, making it even more challenging to prepare for a retake. But it's not all doom and gloom. The good news is that the vast majority of candidates, 85% to be precise, do pass the exam on their first attempt. That's a testament to their hard work, their preparation, and their determination to succeed. And it's a beacon of hope for those who are about to embark on their own NCLEX RN journey. So, what does this all mean for you? Well, it's a wake-up call, a reminder that passing the NCLEX RN exam is no small feat. It requires serious commitment, rigorous preparation, and a clear understanding of what the exam entails. It's not something to be taken lightly or left to chance. It's a challenge that demands your full attention and your best effort. But don't let this statistic scare you. Instead, let it motivate you. Let it drive you to prepare as thoroughly as possible for the NCLEX RN exam. Let it inspire you to push past any doubts or fears you may have and to strive for success. After all, the only statistic that truly matters is your own personal one, whether you pass or fail the exam, and that's entirely within your control. This number underscores the challenge of the NCLEX RN exam. The NCLEX RN exam, a necessary step in becoming a registered nurse, tests your knowledge and skills in providing safe, effective nursing care. This exam is more than a simple test. It's a milestone, a rite of passage for all aspiring nurses, a gateway to a fulfilling career in the healthcare industry. The National Council Licensure Examination for Registered Nurses, or NCLEX RN, is designed to ensure that you are ready to begin practicing safely as an entry-level nurse. Administered by the National Council of State Boards of Nursing, the exam covers a wide range of topics, from health promotion and maintenance to psychosocial integrity. Now, you might be wondering, what exactly does the NCLEX RN exam entail? The exam is a computer adaptive test, meaning the difficulty of the questions you receive will change based on your previous answers. This unique feature ensures that the exam is a fair and accurate measure of your nursing knowledge and abilities. The number of questions can vary from a minimum of 75 to a maximum of 265. The exam will continue until the test algorithm is 95% confident that your abilities either fall above or below the passing standard. The content of the NCLEX RN exam is diverse and comprehensive, reflecting the wide range of knowledge and skills required in the nursing profession. The exam covers 4 major categories: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. The safe and effective care environment category evaluates your understanding of management of care and safety and infection control. This includes topics like delegation, prioritization, client rights, confidentiality, and accident prevention. Health promotion and maintenance tests your knowledge on growth and development, prevention and early detection of diseases, and pregnancy and childbirth, among other topics. It's all about promoting health and preventing illness. Psychosocial integrity assesses your ability to provide care to clients experiencing mental health disorders, stress, or loss. This section covers topics like coping mechanisms, crisis intervention, and therapeutic communication. Physiological integrity, the largest category, checks your understanding of basic care and comfort, pharmacological therapies, reduction of risk potential, and physiological adaptation. This section tests your knowledge on a wide array of topics, including medication administration, invasive procedures, and interpreting client data. As you can see, the NCLEX RN exam is quite comprehensive, and it requires a deep understanding of a wide range of nursing concepts. But don't be overwhelmed. With the right study plan and preparation, you can conquer this exam. One key strategy to succeeding in the NCLEX RN exam is to practice, and practice some more. Familiarize yourself with the type of questions that appear on the exam. Use study guides and practice tests to improve your test-taking skills and boost your confidence. Remember, the NCLEX RN is not just testing your knowledge, but also your ability to apply that knowledge in different scenarios. So it's not enough to memorize facts. You need to understand concepts and develop critical thinking skills. In conclusion, the NCLEX RN exam is a critical step in your journey to becoming a registered nurse. The exam tests your knowledge and abilities in a wide range of nursing topics, from safety and infection control to mental health and pharmacology. Your success in this exam hinges on adequate preparation. So, immerse yourself in the world of nursing. Study hard, practice often, and believe in your abilities. After all, this exam is not just about passing. It's about proving to yourself and to the world that you are ready to make a difference in the healthcare industry. Remember, the journey to becoming a nurse may be challenging, but it is also rewarding. So keep pushing, keep learning, and never give up. Your dream of becoming a nurse is within your reach. Test takers often grapple with stress, time management issues, and a vast array of topics. It's like walking into a labyrinth, never quite sure which turn will lead to success. Stress, for example, can be a silent enemy, creeping in unannounced and clouding your ability to think clearly. It's not uncommon for students to find themselves staring blankly at a question they've studied, unable to recall the answer due to stress-induced memory blocks. Then there's the ticking clock, a constant reminder of the limited time frame. Balancing the need to answer questions accurately and the pressure to do so quickly can feel like juggling flaming torches. And let's not forget the vastness of the exam content. From pharmacology to patient care, the breadth of topics can be overwhelming, like trying to drink from a fire hose. Each topic is a puzzle piece, and missing one could mean the difference between passing and failing. These hurdles, while significant, are not insurmountable. The NCLEX RN exam covers critical areas such as pharmacology, safety, and patient care. Pharmacology, the study of drugs and their effects on the body, is a cornerstone of nursing. It's not just about memorizing drug names, but understanding their uses, side effects, and interactions. Next up is safety. As nurses, we must ensure the well-being of our patients at all times. This includes infection control, medication administration, and environmental safety. Lastly, we delve into patient care. This is the heart and soul of nursing. It encompasses everything from basic needs like hygiene and comfort to complex procedures like wound care and telemetry monitoring. Each of these topics is a world in itself, and the NCLEX RN exam expects you to navigate them with confidence and competence. So let's roll up our sleeves and dive deeper into these subjects. A deep understanding of these subjects is crucial for success. One strategy that can dramatically improve your chances is consistent, focused practice. Now, you might be thinking, of course, practice is important. We've heard that 1,000 times before. But let me tell you, when it comes to the NCLEX RN exam, it's not just about practice. It's about the right kind of practice. It's about deep diving into the core topics like pharmacology, patient care, and safety, and really understanding them, not just memorizing facts. It's about facing the tough questions, the ones that make your brain hurt, and working through them until they don't feel so tough anymore. It's about getting comfortable with the uncomfortable, because that's where real learning happens. This kind of focused, consistent practice can help you overcome common challenges, conquer your fears, and walk into that exam room with confidence. Practice, they say, makes perfect. and with the NCLEX RN exam, this is no exception. In summary, the NCLEX RN exam is a challenging yet achievable hurdle. Not only is it a test of knowledge, but it is also a test of endurance, resilience, and determination. It is the final step in your journey to becoming a registered nurse, and it's not something to be taken lightly. Let's take a moment to reflect on what we've covered today. We began by revealing a startling statistic that fewer than half of all test takers pass the NCLEX RN exam on their first try. This is not meant to discourage you, but rather to underscore the gravity of the challenge ahead. This statistic is a wake-up call, a reminder that this exam requires serious commitment and preparation. We then delved into the NCLEX RN exam itself, a computer-adaptive test that assesses your abilities in various nursing domains. The exam covers a wide range of topics, from pharmacology to safety and patient care, with questions designed to test your ability to make sound judgments in different clinical scenarios. One of the key challenges faced by test takers is dealing with the unpredictability of the exam. With a pool of thousands of questions, you could be asked anything. This uncertainty can be overwhelming, but remember, it's not about knowing everything, it's about knowing the right things. We explored some of the fundamental topics that you can expect in the NCLEX RN exam. Pharmacology, for instance, is a crucial part of nursing practice, and you can expect to encounter questions about drug classifications, mechanisms of action, and potential side effects. Patient care is another major area, where you will be tested on your understanding of patient rights, ethics, and communication skills. Safety is also a significant part of the exam. Here, you'll face questions about infection control, emergency procedures, and patient safety protocols. Each of these areas requires a deep understanding and the ability to apply your knowledge in various clinical scenarios. We also highlighted a key strategy that can significantly improve your chances of passing the exam. That is, the importance of understanding the rationale behind each question. The NCLEX RN exam is not just about memorizing facts and figures, but understanding the why and how. This deeper understanding will enable you to tackle a wide range of questions, even those that you might not have specifically prepared for. But perhaps the most important point we discussed today is the importance of thorough preparation. Preparing for the NCLEX RN exam is not about cramming in the weeks leading up to the exam. It's about consistent, focused study over an extended period. It's about understanding your strengths and weaknesses and tailoring your study plan accordingly. It's about practicing with sample questions, learning from your mistakes, and constantly improving. This level of preparation requires commitment and discipline. It might require sacrifices like giving up social outings or leisure activities. But remember, this is a temporary phase in your life, and the rewards at the end of it are well worth the effort. The pride of being a registered nurse, the opportunity to make a difference in people's lives, and the satisfaction of overcoming a significant challenge. These are the rewards that await you at the end of this journey. In the end, the NCLEX RN exam is not just a test of knowledge, but also a test of character. It's about perseverance, resilience, and the determination to succeed. So, as you prepare for this formidable exam, remember to take care of yourself, believe in your abilities, and never lose sight of your goal. Thorough preparation is your best weapon against this formidable exam. So arm yourself with knowledge, equip yourself with the right strategies, and step into the exam hall with confidence. You've got this. For more tips and strategies, check out our other NCLEX RN exam preparation videos. Let's pause for a moment and reflect upon the journey we've embarked on together. We started off by unveiling the startling statistic that every year, a significant percentage of nursing students fail to clear the NCLEX RN exam in their first attempt. That, in itself, is a testament to the challenging nature of this examination. But, as we've discussed, it's not an insurmountable challenge. We then ventured into the vast and intricate world of the NCLEX RN exam, shining a light on its structure, its importance, and its role in shaping the future of aspiring registered nurses. We understood that this exam is not just a hurdle to cross, but a stepping stone towards a rewarding and fulfilling career in nursing. Addressing the common challenges and fears associated with the exam was our next course of action. We discovered that these hurdles, although daunting at first, are merely stepping stones on the path to success. The fear of failure, the overwhelming volume of study material, the pressure of time management, and the anxiety of the unknown, all these are part and parcel of the journey, but they don't define the destination. We then delved into the fundamental topics that form the crux of the NCLEX RN exam: pharmacology, safety, patient care, and much more. These are not mere subjects to memorize, but pillars of knowledge that uphold the noble profession of nursing. Understanding and mastering these topics is key to not just passing the exam, but excelling in your career. Our journey reached a climax as we disclosed a key strategy that can significantly bolster your chances of passing the NCLEX RN exam. This strategy, like a secret weapon, can be the difference between a pass and a fail. But remember, it's not a magic wand that guarantees success. It's a tool that, when used wisely and diligently, can pave the way to victory. We then took a moment to recap and emphasize the importance of thorough preparation for this crucial exam. Because at the end of the day, there is no substitute for hard work, dedication, and perseverance. The NCLEX RN exam is a test of not just your knowledge and skills, but your passion and commitment towards nursing. And now, we arrive at the final stage of our journey, a call to action. We encourage you to explore more NCLEX RN exam preparation videos on our channel. Each video is a treasure trove of information, tips, and strategies that can guide you towards success. But remember, this is not a one-way street. We value your input and experiences. Share your own study tips, your strategies, your experiences in the comments section. Your insights could be the guiding light for another nursing student navigating the choppy waters of NCLEX RN exam preparation. This is a community, a support system, a platform for shared learning and growth. Let's leverage this to ensure that every nursing student who steps into the battlefield of the NCLEX RN exam comes out victorious. Remember, your success in the NCLEX RN exam is a testament to your dedication and hard work. Good luck!